My Doctor, your health anytime, anywhere.
Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa Joy. I am a medical student in my 4th year and I am your host. So for those who are new around here, My Doctor podcast is basically a talk show where we talk about health, what happens in your body when you're experiencing certain stuff, how can you prevent certain diseases and illnesses, what are the signs and symptoms, when should you seek for help. So we basically bring experts, medical doctors, medical students, and in all aspects of health to talk about health and health issues. So for this upcoming season, we're going to be discussing very many aspects of health, like mental health, gynecology, dentistry, pediatrics. How can we keep our children healthy? So stay tuned. So for today, we're going to be discussing dental tips. And what we're going to be discussing today, you may think you know about it, but you'll be shocked. I assure you we're here to relearn, unlearn, and learn. So today we're going to be talking about how to brush. We're going to be talking about brushing. Are you brushing the right way? When should you brush? How many times a day? We're going to be talking about toothpicks and flossing. So please stay tuned. So for today, I have a very beautiful guest with me. Yeah. I'm going to let her introduce herself. You're welcome, Pearl.
Thank you.
How are you doing?
Fine, thank you. How are you?
I'm fine. Could you please introduce yourself to our audience?
Okay, thank you. My name is Akankwasa Pearl. I'm a student at Uganda Christian University, School of Dentistry, pursuing a Bachelor's of Dental Surgery, and I'm currently in my 4th year.
Okay, you're very welcome, Pearl. So we're going to dive into our topic right away. So according to WHO, most people don't know how to brush. We're being taught how to brush the wrong way. Yeah, we don't even know how to use a toothbrush. We think we are brushing, but we are not. So we could start with the technique of brushing. How should we brush? Yeah.
Thank you so much for the opportunity. Most of us have grown up thinking we have to brush because maybe sometimes you're going out, you don't want to smell for people. Sometimes you're like, oh, my mom said I should brush every time I wake up. So we think like brushing is a routine, but us as dental personnel, we have to brush because we want to keep our teeth healthy. Because I happen to be in clinic where one of our doctors asked the patient, do you want to enjoy your money or you just want to... You don't want to enjoy money. Why? Because if you're going to maybe like to a restaurant or to a hotel and like you want to eat chicken, you can't eat chicken without your teeth. So we're going to learn how to keep our teeth healthy. We're going to learn about different tips of oral hygiene that are going to enable our teeth to remain firm because we want to enjoy our money, and also we don't want to... It's also aesthetically unpleasing if maybe like you don't have your front teeth. It builds your confidence if you have all your teeth present. So we're going to begin with how to brush. So most times we think brushing, for example, I don't know, Joy, how you brush. Maybe you can tell us how you've been brushing.
Okay, so I now know the right way how I'm supposed to brush. But before I joined medical school, I was taught in primary that you just like brush up and down and then you open your teeth and like, just up and down and then, yeah.
Okay, so most of us, even me personally, I used not to know how to brush well until I joined dental school. So most times when we are brushing, we just do this, and we don't brush like that. How would we brush the right way? We're supposed to hold that toothbrush, and when you get your toothbrush, you put your toothpaste. So this is our model we shall be using. When you're brushing your teeth, you're supposed to brush your teeth in a circular motion and gently, not very hard. Because sometimes we face patients at school, our dental clinic, where patients come and they say, whenever after I finish brushing, my gum bleeds. So it's because of the technique you're using. So when we brush like this, we are scratching off our enamel, so we are damaging our teeth. At the same time, we are hurting our gums, so we can easily bleed, and also our gums can end up getting inflamed, which is now periodontal disease. So when we are brushing, we are supposed to get our toothbrush, and when you're brushing, remember these are teeth which are going to help you eat good food or do other various things. So take your time. Don't be in a rush like you're brushing, someone is calling you, I'm coming, I'm in a shower. Take your time, get your toothpaste and brush. Brush in a circular motion. brush and finish. Now for what we call the posterior teeth, or like the behind part. Most times when you brush, when your mouth is open like this, it's a bit hard to reach like these areas, especially for like the wisdom teeth. So when we are brushing, we encourage you, like, you just join your teeth together, you pass your toothbrush, you come, and now you see how easy it is. Like, if you would after this episode, you would definitely do it and see. But like when you pass your toothbrush with your teeth joined, yeah, so you will come and like it's easier, because most of our teeth, our wisdom teeth, or what we call what some people call like the last teeth that come with adulthood, like late adulthood, most of those teeth, they are difficult to brush because they are far. So when you close your mouth and like reach gently, you will be able to brush them and they will be good, other than them having food accumulating and then ending up forming plaque, which harbors bacteria, and then bacteria will end up destroying our teeth. So you will brush like this, you also come this side, you brush like this, then you open your mouth, you come down inside. Remember, we're brushing slowly in a circular motion. Yeah. So when you brush like that, you're able to remove all the food. You're also able not to injure your gum. So you brush and also like brush. Then for the front teeth, you tilt your brush on a 45 degrees angle, and then you try to brush like this, removing the dirt. Yeah, that's how we're supposed to brush that.
So you've told us for the back teeth, we close the jaw, right? Now for the front, do we also close the jaw like?
Yes. Okay. You remember I started from out. So you start from out, you brush outside. Yeah. You close your jaw, because if you close your mouth, it's easier that way. But when you open your mouth, you may be entering this side. So it's easy. You close your mouth, you just brush. It's supposed to be a technique you like. Even that closing, in case you're able to actually brush when your mouth is open, you can do that as long as you reach all your teeth and all your teeth surfaces. Because when you're going to get disease like a cavity, it's not compulsory that a cavity will develop here in the middle, what we call the occlusal surfaces. No, it can develop on any surface. That's why we're supposed to clean all the surfaces, and we are going to see that these surfaces in between, what can we do when like a brush can't reach there? Yeah, we're going to see what we can use to actually also remove the food. Yeah.
Okay. So what do we do after brushing? I know this may seem obvious to our audience. Rinse, of course, you rinse. But I want us to talk about that. What do we do after brushing?
Okay, thank you. So when we are done brushing, most times we want to just rinse and go. Like, just spit the foam and rinse and go. But we encourage our patients and also ourselves to either do two options. One, you can either, after brushing, you can either rinse and do what I'm going to tell you, or like after, for example, you finished brushing your teeth. After brushing all your teeth, you can just spit the foam and you get little water and like rinse just like just here in the like here where the tongue is. And also when you brush, don't forget to brush your tongue, because sometimes the tongue can harbor food, and remember the tongue moves in different areas of the teeth. So you can be like, you've brushed, then the tongue, like some people have what they call like fissure tongues, which can keep food. So we're supposed to brush our tongue. So when you finish brushing, you can just rinse just here like in front. Because most times when we are grinding or when we are eating, most of the food is happening this side. So most of the times there will be like food particles left this side. So when you finish brushing, we encourage you to just spit and you rinse just like in front here where the tongue is, so that you don't feel uncomfortable, because we want the fluoride that you've used to remain on the tooth surfaces. Like, we're going to see that whenever you eat food, like for example, I've taken tea in the morning, it's going to the bacteria is going to produce acid, and that acid is going to cause what we call it's going to dissolve the teeth slowly. So when this toothpaste that we are going to use is going to help us remineralize, because it has fluoride. So we want to brush and leave when our teeth are protected. It's like how you stand and like you're being guarded by like very many people around you. So like you are you're very protected, you're sure. So even our teeth, we want them there and just surrounded by the fluoride. So where is
this fluoride from? The toothpaste?
Fluoride is from different things. Fluoride can be from toothpaste, and fluoride can be, for example, in the water we take, fluoridated water. Yeah. So, and for the toothpaste that we use, when we are looking at the toothpaste, it depends. You can have a look that when we are looking at the toothpaste to use, it depends on the fluoride that is there. There is fluoride that is recommended that is going to keep your teeth strong. Some patients will come and tell you, doctor, I've been brushing, but I use this toothpaste, but I don't know if my teeth are not strong. Like I keep getting cavities that are brushing the right way. So when we are using or when we are buying toothpaste, we're supposed to buy toothpaste that has fluoride that is between 1,000 to 1,500 ppms.
1,000 to 1,500 ppm.
Yes.
Okay.
For example, this has 1,450 ppm, so it's in the range, so it's good to use. So if you are educated, you can go to a supermarket or a shop and you read. If you're not able to read, then you can just ask a person. You ask them, they can read for you. So you just check, because you may use, and also sometimes the toothpaste you use, make sure it has fluoride, because fluoride is the one that helps us in remineralization, like inhibiting that dissolution of the teeth that the bacteria are trying to do. So when you're buying toothpaste, make sure you buy toothpaste that has fluoride. But fluoride has to be to this amount, 1,000 to 1,500 ppm. Yeah.
Okay, so let me take you back to what we're talking about. So you talked about how we should sparingly rinse to leave some fluoride. But then, like, when you test toothpaste, it tastes sweet. I don't know if it's just me. So isn't there some sugar in the toothpaste? So if we leave that bit of the toothpaste in the teeth, won't we again revamp the bacteria? Yeah.
So I had also not mentioned, for those who want to, like, if you really want to rinse and you feel like it's uncomfortable, you can actually like rinse your mouth properly. Then you just apply a little toothpaste and like apply on your teeth surfaces. Like you just put it and you go to work, you go watch your TV, do your other things. So you either like after brushing, sometimes you brush, you feel like your mouth has been dirty, you rinse, then again you brush. When you're done, you just spit, rinse here at the front part, and like if you don't want, you can rinse again. Then you just apply a little and like put on your teeth surfaces again. So now for the sweet part, there are different components in toothpaste. So they are just a component like that's a sweetener that just makes a toothpaste sweet, but it's not it's sugar free. For example, that's why you see when you go like to a supermarket or a shop, you find that kids, they're like 0 to 1 years. There is different toothpaste for them, 1 to 2, 2 to 5, like different ages, and this other one for us, the adults. So now for those for the young kids, you realize if you give them this adult toothpaste, they'll be like, oh, it's sour, mommy, oh, sister, it's sour, because it's sour for them. But for them, they add that more sweetener, but it's not actually sugar. It's just to make them maybe like to brush well without having that sour component here.
Okay. Thank you so much. I'm sure people have learned how to brush. Let's brush the right way from now on. So, when should we brush? Like how many times should we brush during the day?
Okay, so for brushing, most times we think, like I told you, it's like a constant. We brush in the morning because we've woken up. You don't go out when you're having a smelling mouth. But ideally, we're supposed to be brushing 3 times a day. 3 times a day means in the morning after breakfast, then after lunch and after dinner. But sometimes it's practically impossible to do that, because why do we have to brush 3 times a day? We assume that ideally a person is taking breakfast, lunch, and dinner. So we are supposed to be brushing after a meal. So why do we have to brush every after a meal? When we eat something, for example, in the morning I took tea and maybe like a samosa or like bread, we have things that have sugar in them when we eat them. So when we eat them, they will come on our tooth surfaces like this, and in our mouth we have normal flora. So this normal flora is going to come and start feeding on the remaining sugar particles that remain. So every time it feeds on those particles, it's going to release what we call acid. Now that acid is one that keeps on dissolving it with slowly. You end up having like a small hole, or what we call a cavity. You end up having like a cavity. It ends up like when it gets the entrance, now it starts penetrating into your deeper tissues. Yeah, so we are supposed to be brushing and after like eating. So when we are brushing, we clear our teeth surfaces so that if this normal flora comes to feed on it, it doesn't find anything. So our teeth are safe. So when we are brushing, we're supposed to brush in the morning after breakfast. Then at lunchtime, most times it's you're at work or you have like a short period of time, or like you're in school, they are chasing you, go back to class, or you are busy generally, you're not at home. So what do you do for that? We advise you to rinse with water, because water also has a fluoride. For example, if you check like a mineral water, like Rinzeri, I think has like 0.3 ppm. It's little, but at least it's some aspect of fluoride. Yes, remember if we said fluoride helps us with remineralization. So if you rinse your mouth with that water, at least like it will clear most of the sugar particles. And then remember at night you're going to brush. Now brushing at night is so much needed, because not brushing at night doesn't mean like you've come from work, it was very hot, or you had a stressful day, you want to take a shower, and like you shower, then you eat food, then you sleep. No, you do all things. If you want to brush, you can brush, but like the ideal time to brush is when you're going to bed. Like, don't eat food, you brush, then maybe like if you're like a dad, you tell your daughter, make me some tea, or like they brought for you some tea, you take tea and then you sleep. No, like eat everything you want to eat. If it's food, if it's tea, then when you're done, now you brush. Now the thing about the night time is that, remember at night your mouth is not working. It's just there. It's not working. So bacteria has enough time to come and feed on, to look for all those sugar particles and produce the acid. So imagine the bacteria comes and find your teeth are guarded with fluoride. So your teeth will be what? Safe. Yeah.
So you talked about some types of water having fluoride. Do all types of water have fluoride? Like if I rinse with tap water or tank water, is there some sort of fluoride in all types of water, or we should still look at the bottle to look for the fluoride?
Any type of water has fluoride, but it just depends. Like some areas like Chisori in Uganda have like too much fluoride in them. Actually too much. That's why I told you it has a range, 1,000 to 1,500 ppm. So when you go beyond the range, you get what we call fluorosis. So, but most of the water that we have, like drinking water, has some little fluoride, but it's not as much, because it's not as much as in the toothpaste. So at lunchtime, just rinse. Then in the morning, that's why I said we're supposed to brush ideally twice daily. And effective brushing is not brushing morning before breakfast and evening before dinner. Effective brushing is when you brush the right way, morning after breakfast and in the evening after dinner and tea when you're going to sleep.
Okay. So we've been using that toothbrush, yeah? So it got me thinking, what is the best type of toothbrush to use? You know, some toothbrushes have hard bristles, others have soft bristles. Which one is recommended?
About the toothbrush, most times we think, like how we normally brush, like we are very hard. Most times we think a hard bristle toothbrush is best, but actually no, a soft toothbrush is best. Like even if you would feel this, it has soft bristles. This is what we are supposed to use. This is what we recommend, because remember we said that every time we are brushing, if you brushed with a very hard toothbrush, it's easy to injure your gum. And remember, every time, like our teeth have layers. We have the enamel, we have the dentine, we have the pulp. Now the dentine and pulp have nerves, which are for sensitivity. So every time we brush with a very hard brush which has hard bristles, it's like we're removing the enamel layer. So when we remove the enamel layer, it's going to expose our dentine, and we're going to have sensitivity. Sometimes a patient comes and tells you, Musao, I have pulilanga masanyalazi because of the toothbrushes. Sometimes we use, and remember we are using a lot of force. Initially, we've been using a lot of force. So you're using a very hard toothbrush. So you're brushing like this, you're injuring your gum at the same time you're removing that. With time, the enamel layer keeps getting off. So we advise a soft bristle toothbrush so that you clean your teeth well. I don't know if you use that soft toothbrush before comparing with the hard one, but that gives you like opportunity to clean your teeth very well and without injuring your gum. Yeah.
Okay. Then also still in the aspect of cleaning teeth, most times when you after eating meat or any meal, we use toothpicks. Even in restaurants you reach, of course there are toothpicks there. You've eaten meat, use a toothpick. At home, toothpicks. So would you advise us to use toothpicks? Are they safe for our teeth?
Okay, thank you. So we've grown up using toothpicks. Even me, I used to use toothpicks. But us as dentists, we encourage people to use what we call dental floss. Dental floss comes in different forms. We have this, and we also have this, which is like a string. So I'll just illustrate how to use both of them. So when we use a toothpick, like for example, you're going to see this. Like for example, I told you that we have some areas when we brush, like the toothpaste, the toothbrush will not reach. Like for example here, which we call interdental space. So when you brush, and sometimes the food, like sometimes like you eat meat, like you've said, it gets stuck. But sometimes there are food particles that are there, and it's very hard to brush in between the teeth, because sometimes we have like very, very close teeth with no spacing. So when we use a toothpick, it's most times I think you see a toothpick it's a bit narrow and a bit broad. So when you're using a toothpick, like sometimes you may even pierce your gum, you injure your gum, which can lead to periodontal disease. And also the most bad thing about it is it doesn't actually even sometimes clear the food all throughout, because like sometimes it breaks, it brings uncomfortability. But it's very, if you're using a floss, it's very easy, because like you see the string is small. It's very easy to remove the food, and the toothpick it's not going to hurt your gum. And the other thing is that you're going to remove all the food that is there, and you feel comfortable afterwards. So we encourage people to use dental floss, not toothpicks, because toothpicks most times hurt our gums, which is going to lead to periodontal disease. Yeah, because every time your gum gets disease and keeps going down, even it ends up like your teeth shaking and they're not stable. Remember, we said we want our strong, healthy teeth. Yeah.
So you've talked about the toothpick causing harm to the gum, but that string also looks like it can cause harm. Like it's a string. So is there, like, talk about that, like is there a way, how is it better than a toothpick in that aspect of causing harm?
Okay, because you would also ask me this other thread. You would ask me this, why would it not injure our gums, yet it also looks very sharp? This floss is coated with wax. So when you are cleaning, or when you are trying to remove food particles in between, it has wax, so it means it's not going to injure our gum. It will be soft to our gum. And remember, I want to protect our gums. So if you're using this, you can have any that is comfortable with you. For example, if you're using this, you just have, like how you see, you only use this part.
The string.
Yeah, the string, not this other side. So you use this, you just come and like put the string in between your teeth. You see how it's very easy and comfortable. You just open your mouth and like take it where you want.
Put the string.
Yeah, you use the string and make sure like you just keep removing the food.
Okay.
Yeah. Then for this, it has a bit of a technique, but you just have to make sure you hold the string firmly so that you're able to use it well. So you just you get it, and this string is sterile. Okay. Remember, every time you introduce something in between your teeth that is dirt, it can have a bacteria, and then bacteria end up causing the acid, producing the acid, and causing the dissolution of our teeth. So you're not supposed to touch in the middle. Like if I've touched here, I'm not going to use it. So it has like a cutting thing, so you just cut.
Okay.
Yeah. And you're not supposed to reuse it, or like washing, you're gonna do like reusing, no. So you just get a string, you pull the one that is comfortable for you, according to how big your jaw is. So you pull, when you say this is enough, so you would just tie it around, then like this. Then you also come and tie it around using your middle finger. Then when you make sure it's strong and firm, you use now this to make it strong, and then now you start putting it in between your teeth like this.
Okay.
Depending where the food is. Like now I've made this was short, but if like I wanted to take it behind, I could like make it long. Yeah, just depending. It's just comfortable. Like how do you want to use it? But as long as you use this to hold it and use this, it becomes firm, so you can put it anywhere you want.
Okay. And remember, don't touch the middle.
Yeah, don't touch the middle. Once you use it, you have to dispose it off. And also our toothbrushes, most times we use them for like a year. We don't know when to change them.
By the way, yeah.
Yeah, so when we have to often change our toothbrushes, we recommend like 3 months, using a toothbrush for 3 months after you discard it. But if you have like braces, it has like metals that normally make these they damage the bristles faster. So if you have like braces, you can change like after 1 month, depending. You can even touch and see if it's like, if the bristles are no longer that strong, yeah, and you change them. But basically most times 3 months.
Okay.
Yeah.
I think we've come to the end of this episode. Thank you so much, Pearl, for coming to teach us how to brush, when to brush. I'm sure our audience has learned a lot. So I'd like to request you if you have any closing remarks for our audience in regards to dental tips, something, a last message to the audience.
Thank you. So like how I've taught you how to brush, in case of any challenge, you can always reach out to our dentist. And also we encourage people going for dental checkups often, because sometimes you may actually think you've been brushing the right way, but if you don't go for a checkup, the doctor will tell you, oh, you may have a cavity developing here, so they will treat it a bit early. So let's get used to brushing our teeth well and going for just regular checkups, because when we wait for the last time, we normally present when you have sleepless nights, when you have a cavity that is paining you, no longer eating food. That's when we present to the doctors, but it's not always the right thing to do. Let's always go for regular checkups. Yeah.
Okay. Thank you so much,
you.
Pearl. We
You're
really
welcome.
appreciate your presence here, and I'm sure we've learned a lot. To our audience, thank you so much for watching this far. Hope you've learned how to brush the right way. From today, we're brushing the right way. We are rinsing. We are brushing 3 times a day if you can. If you can't, you can rinse in between. You've seen the toothbrush to use soft bristles. You've seen the toothpaste to look for with fluoride 1,000 to 1,500 what?
ppms.
Yeah. So I'm sure you've learned a lot. And thank you so much for watching this far. We're going to have more of these episodes discussing different topics. And so stay tuned. We'll be airing every Saturday. This is the My Doctor podcast. My name is Joy Mwesigwa. My Doctor, your health, anytime, anywhere.
My Doctor, your health anytime, anywhere.